Of those 50 million Americans that suffer from it, about 10 million of them really suffer very badly. They go to the extent that they have depression and suicidal thoughts, and I get emails every day.
Many people deal with tinnitus, also called phantom sounds. But what exactly is tinnitus? It's that ringing in your ears. Tinnitus is often likened to other phantom sensations, such as phantom limb pain. In this situation, someone who has lost a limb due to an accident or explosion may still feel sensations as if the limb is there. The brain is responsible for this. Even though the limb is gone, the neurons that represented it are still active, which can create the sensation that the limb still exists and can even cause pain in that area. Now, like with any health issue, it's important to figure out the cause. So Barbara O'Neill looked into it and found several potential reasons. She shared a story of a man who used to work with a jackhammer as one example when people come to her seeking help for the condition.
Tinnitus, or ringing in the ears. One man used to use a jackhammer, and many young men that use jackhammers don't feel they need to wear earmuffs.
O'Neill shared a story about a man who used to work with a jackhammer. Like many young guys in similar jobs, he didn't think ear protection was necessary. That constant loud noise ended up damaging the delicate parts of his ear. Now in his late 50s, he deals with a buzzing or ringing sound. He found out that cutting out certain allergens helped. These included things like hybridized wheat, oats, which may be okay for some people but not others, dairy, peanuts, and refined sugar. Here she explained how these foods can contribute to tinnitus. But before we move on, I'd like to mention there could be more than one cause of the tinnitus. But it is true that noise-induced hearing loss is the most common cause of tinnitus, with prolonged exposure to loud sounds like machinery, concerts, or gunshots being the main culprits. Musicians often experience tinnitus surprisingly frequently because they're exposed to louder sounds more than they realize. The group most at risk for tinnitus is war veterans, who are constantly exposed to loud sounds from artillery, bombs, and explosions. An important factor to highlight is stress. It plays a significant role in developing tinnitus. While loud noise exposure can lead to it, combining that with stressful situations greatly increases the likelihood. As a result, veterans often return from combat with tinnitus. According to the Veterans Administration, tinnitus is the most common reason for benefits paid to veterans, with hearing loss being the second most frequent cause. But still, up to 90% of people with tinnitus experience some level of hearing loss due to noise exposure. Other cases might cause natural degeneration of inner ear cells, as people's age can lead to both hearing loss and tinnitus. This condition is especially common in older adults, as the ear's ability to function properly diminishes over time. Another ear blockage, such as congestion or earwax buildup, can lead to changes in ear pressure, which may trigger tinnitus. Fluid from infections or other debris can also cause blockages that contribute to this condition. Certain medications, known as ototoxic drugs, can cause or worsen tinnitus as well. Common offenders include non-steroidal anti-inflammatory drugs, NSAIDs, certain antibiotics, diuretics, and chemotherapy medications. Injuries to the head or neck can impact the inner ear, hearing nerves, or brain functions involved in sound processing, which may lead to tinnitus. Trauma in these areas can disrupt normal auditory function and trigger this condition. Several medical conditions can cause tinnitus, including Meniere's disease, which affects the inner ear, otosclerosis with abnormal bone growth in the ear, TMJ disorders involving the jaw joint, and cardiovascular problems that impact blood flow. These underlying health issues can play a significant role in the development of tinnitus. Lifestyle factors such as high stress and fatigue can make tinnitus symptoms worse. Additionally, habits like smoking and heavy drinking may increase the risk and severity of the condition. Tinnitus can arise from a mix of causes, including loud noise exposure, aging, ear blockages, medications, injuries, and various medical issues. Understanding these factors is crucial for managing symptoms and finding the right treatment. If you have persistent tinnitus, it's a good idea to consult a healthcare professional for proper diagnosis and management options.
Well, they are the most common allergens. And the probably first response when someone has an allergy to these foods is excess mucus in the eustachian tubes. The eustachian tubes are...
According to O'Neill, common allergens can lead to excess mucus in the eustachian tubes, which connect the ears, nose, and throat. Sinus congestion is also a contributing factor to tinnitus. The man she mentioned realized that when he stopped eating foods he was allergic to, like dairy, peanuts, and sugar, his eustachian tubes cleared up and his tinnitus improved. He also used to drink several pints of beer every night, so cutting back on alcohol helped too. Overall, eliminating these foods made a significant difference for him about the man who worked with a jackhammer.
But what he has done, he has trained himself not to hear the tinnitus. He said, I cannot hear it, and then if someone talks about it, then I can hear it. I guess it's very much like when someone lives near a train line.
He trained himself to tune out the tinnitus, saying he only hears it when someone mentions it. It's similar to living near a train line. When O'Neill visited her son, she woke up every time a train passed, while he slept soundly because he was so used to the noise. She also mentioned cicadas at Misty Mountain, which can be incredibly loud in summer. People who are accustomed to that sound often don't notice it until someone else points it out. She humorously compares this to someone living with a nagging partner who might eventually stop hearing the complaints altogether.
The proverbs that say it's better to live in the wilderness than with a contentious, clamorous, and angry woman. She said, what can I do for this tinnitus? So I began to investigate.
So here she shares the story of a woman who asked for help with her tinnitus and worked at a gym where loud music was played during high-intensity interval training, HIIT, classes. The loud, booming music was meant to energize the class, but O'Neill suggested using something like the William Tell Overture, which is fast-paced but not as loud. She explains that people exposed to loud music or noises, like soldiers firing guns during wartime, are more likely to suffer from tinnitus.
Mechanisms in the ear have been damaged. Can they be healed? Not really. Not really, because it's right inside the ear. The body does heal, but as my friend Jeff found, who'd worked with the jackhammer.
Barbara O'Neill explains that tinnitus often results from damage to the fine mechanisms in the ear due to loud noises, which can't fully heal. While the body can adapt, complete recovery is unlikely. She mentions a friend, Jeff, who worked with jackhammers and experienced tinnitus, and a woman who reduced her symptoms by stopping high-intensity training with loud music. The woman switched to DVDs, where she could mute the loud music and play classical music instead, improving her condition by 50%. O'Neill also connects severe sinus problems and blockages in the eustachian tubes with tinnitus and even sleep apnea, emphasizing that breathing through the nose is crucial since it purifies, warms, and humidifies the air. Barbara O'Neill mentions that doctors at the Mayo Clinic discovered in the 1990s that yeast was a common factor in all cases of sinus infections and congestion. This finding suggests that sinus problems may often be linked to yeast issues, which can contribute to blockages and infections in the sinuses, potentially exacerbating conditions like tinnitus.
And we also had a ear, nose and throat specialist nurse attend our program. She's actually attended 3 times now, and she testifies. She said, we pull green slime out of people's sinuses.
Barbara O'Neill points out that sinus problems can often be linked to allergies and exposure to harmful substances. According to her, ENT specialists may remove mucus or green slime from the sinuses, but they often don't address the root causes. She explains that yeast, mold, and bacteria can thrive in these environments, particularly when the person consumes high-sugar foods, dairy, peanuts, alcohol, or is exposed to chemicals and mold. O'Neill suggests that sinus congestion can start due to allergens, like dairy and peanuts, or exposure to harmful elements such as chemicals and mold. For some people, particularly children, dairy can lead to asthma or bronchitis because of its mucus-forming nature. As a result, eliminating these factors, especially chemical exposure, is crucial in managing and preventing sinus infections.
If there is any exposure to chemicals, and that must stop. I know sometimes cleaners, we've had very sick cleaners do our program who are exposed to chemicals a lot.
Barbara O'Neill recommends using golden seal snuff as a natural remedy to help clear out the sinuses. Golden seal, available in powdered form, can be lightly sniffed into the nostrils a few times a day to reach the sinus areas. It has multiple beneficial properties, being antifungal, antibacterial, and antimicrobial, which can aid in clearing infections. She emphasizes the importance of removing foods that might contribute to sinus issues, like those high in sugar, and mentions that it could take about 2 months to see full results after stopping such foods. In the meantime, regular use of golden seal. Golden seal, Hydrastis canadensis, is an herb from the buttercup family, commonly used in supplements in the US. It contains berberine, which may have antibacterial and antifungal properties, as well as effects that can lower blood pressure and help with irregular heartbeats. However, many beneficial compounds in golden seal aren't well absorbed when taken orally, leading to uncertainty about its effectiveness compared to berberine alone. People often use golden seal for various ailments, including the common cold, upper respiratory infections, hay fever, diarrhea, and constipation. Despite its popularity, there is a lack of solid scientific evidence supporting these uses. If this herb does not work for you, you can try other effective remedies and strategies to help relieve tinnitus symptoms. White noise machines. These devices produce ambient sounds like static or nature sounds, which can help mask the ringing or buzzing associated with tinnitus. Used during sleep or quiet moments to distract from tinnitus. Sound therapy. Listening to calming sounds or music at a low volume can help divert attention from tinnitus. For example, the Widex Sound Relax app offers soothing sound stimulation through hearing aids or smart practices such as deep breathing, progressive muscle relaxation, and meditation can reduce stress and anxiety, which may exacerbate tinnitus. These techniques promote overall well-being and help manage the emotional impact of tinnitus. Regular exercise. Physical activity improves blood circulation and reduces stress, both of which can be beneficial for managing tinnitus. Aim for at least 30 minutes of moderate exercise most days of the week. Proper sleep. Establishing a consistent sleep routine can improve sleep quality, reducing stress and anxiety related to tinnitus. Create a comfortable sleep environment to enhance rest. Dietary changes. Some individuals find that reducing caffeine, alcohol, salt, and certain food additives can alleviate their symptoms. Monitor your diet to identify any potential triggers. Cognitive behavioral therapy, CBT. This therapy helps individuals change their perception of tinnitus and develop coping strategies. CBT has been shown to be effective in reducing the distress caused by tinnitus. Acupuncture and herbal remedies. While evidence is mixed, some people report relief from tinnitus symptoms through acupuncture or herbal supplements like ginkgo biloba. Consult with a healthcare provider before trying these options. Hearing protection. Protect your ears from loud noises to prevent further damage and worsening of tinnitus symptoms. Consultation with healthcare professionals. If home remedies are insufficient, seek advice from an audiologist or ENT specialist for potential medical treatments tailored to your condition. That's all for today. If you found this information helpful, give us a thumbs up and share it with someone who might benefit. We'd love to hear from you. Have you or someone you know experienced tinnitus or something similar to phantom pain or sound? And what remedies have you tried? Let us know in the comments. Don't forget to subscribe for more health tips and hit the bell icon so you never miss an update. Thanks for watching, and we'll see you next time.